Rabies is a deadly viral infection most often carried by wild animals and is contracted after a person or animal is bitten or scratched. The virus enters the human body and invades the central nervous system, causing encephalomyelitis, inflammation of the brain and spinal cord. The virus enters the muscle cell after a bite or scratch and travels on the axons of the peripheral nerves until it reaches the spinal cord and sensory ganglia. Once invasion of the CNS occurs, the virus will continue to spread outward to autonomic and sensory nerves, affecting organs and tissues, including salivary glands, where the virus can be excreted into saliva. While we understand the spread and transfer of the virus from wound entry to brain and spinal cord, we do not fully understand how the rabies virus infection causes the neurological disease. However, it is known that death is the most likely prognosis.
The signs and symptoms of a human affected with the rabies virus normally starts like a normal flu. Fever, malaise, general weakness. However, there is an incubation period when the patient is infected but asymptomatic during this phase, can range between 20 and 90 days. The big identifier is tingling and numbness at the bite site. Once rabies hits the central nervous system, the most prominent sign is difficulty swallowing, which results in hydrophobia. Rabies is diagnosed in animals by the fluorescent antibody test, which is recognized by the World Health Organization. For human testing of rabies before death, corneal impressions is done, and saliva, cerebrospinal fluid, and skin biopsies of hair follicles at the base of the neck.
Who is at risk for getting rabies? According to the World Health Organization, rabies occur in more than 150 countries and territories, killing approximately 55,000 people every year. Most of these cases are reported in Africa and Asia. In North America, vaccinations for pets and humans are readily available, therefore the rates are low. According to the Center for Disease Control and Prevention, North America has only reported 36 human rabies-related cases, and the animal of contamination are bats. In Canada specifically, only 3 reported cases of bat rabies.
How do humans get rabies? The first method is when a rabid animal bites an uninfected animal. Through a bite, the cycle repeats when an infected animal bites the humans too. Common animals are raccoons, bats, and dogs. The virus travels through the nerves, but the bitten animal shows no signs until the virus has infected the brain and begun to replicate. It takes not more than 3 to 12 weeks, and the rabid animal usually does not live long 1 to 2 weeks. The second method is through non-bite exposure, through scratches, abrasions, open wounds, and mucous membrane through saliva. Last type is a human-to-human, which is extremely rare. Only 8 cases reported due to corneal transplant and 3 cases due to solid organ transplant.
There are no treatment for rabies that can cure the disease once the symptoms appear. Treatment for rabies consists of a regimen of 1 dose of rabies immunoglobulin and 5 doses of rabies vaccine over a 28-day period. The first dose of the vaccine is administered as soon as possible after exposure, and additional doses of the vaccine follows on day 3, 7, 14, and 28. Pre-exposure rabies treatment is available for high-risk groups, which include veterinarians, animal handlers, international travelers, and laboratory workers who work with the live virus.
Best prevention for rabies is to have a household pet vaccinated and report any stray animal in your neighborhood. To prevent rabies in human, avoid direct contact, teach children never to handle unfamiliar animal. When traveling abroad, avoid direct contact with wild animals, especially with dogs in developing countries.
The World Health Organization is holding the World Rabies Day on September 28, 2012. The mission is to raise awareness about rabies, provide education on prevention and treatment. Since its start in 2007, they have been able to vaccinate 4.6 million dogs, most of these in Asia and Africa. With continuous education, awareness, and preventative measures, this disease can be eliminated 100%.